Marc Adajar. I'm one of the surgeons of Precision Surgical Group. And if you're watching this video, that means you just had your gallbladder removed and you are about to go home. Now the disclaimer here is that all surgeons treat their patients a little bit differently, and I can't speak for the surgeon if somebody else operated on you besides me or my partners. And basically that's about it. So that being said, I want to make this video because there's a lot that goes into the postoperative care, and if you forget what is written in the brochure or what the nurses tell you, I want you to be able to refer to this if needed. Okay, that being said, you'll first notice that you have 4 incisions. You have an incision at the belly button, either right below or right above, and 3 smaller incisions just below the rib cage on the right side. Now these incisions are closed with sutures that dissolve, which does take a couple weeks for it to dissolve, sometimes a little bit longer, but in general there's nothing to remove. Now these incisions are covered by either, myself I use a glue, which we call dermabond, or it may be covered with tape or gauze, covered with a special type of tape. Now, the dermabond or the glue is waterproof, so you can shower tomorrow morning, or after 24 hours, I should say. And the tapes and the paper tapes and the covering are water resistant. Either way, you can shower after 24 hours. If it's tape or covered with gauze, that will come off likely in the office. Or if it's a glue, it will fall off once the incisions are healed in a couple of weeks. And if it comes to that point, you can peel them off yourself, or it'll just fall off once the new skin regenerates. Now, if your gauze gets wet in the shower, that's okay, just as long as it's after 24 hours. And you can go ahead and pull them off if they get soaked. That's not a problem. You'll see that there's underlying tapes, which you don't have to worry about. Now, with these incisions, you may have some bruising, especially around the belly button. That's normal. That will go away in 2 weeks. However, if you do experience some bleeding at any of the incisions, which is normal when the new blood vessels start to reform, take an ice pack and hold firm pressure there for 5 minutes, and that usually takes care of it. If that doesn't work, please call our office right away. Now, we also want to watch for redness or any pus-like drainage, green or yellow pus-like drainage that's coming out of usually the belly button. If that happens, call us right away, because that could be what we call an incision infection or a wound infection, which usually can be taken care of with some antibiotics. And in other cases, we may have to open up the incision, but that's actually quite rare. But if that happens, give us a call. Okay, so now you will probably experience some pain under the ribs on the right side where your gallbladder was. That's normal, though it's worse in the first 72 hours, but after that it will get better. So use your pain medication as prescribed. The way that you use the pain medication is usually you take 1 tablet every 4 to 6 hours and see how that does. If that doesn't work, then take 2 tablets. But it's very important that you monitor your response to the pain medication, because as you get better, you should be taking less and less. And hopefully by the time you see us in the office, you won't be taking any medication, or you'll be only taking maybe some extra strength Tylenol or some ibuprofen. We don't want you to be on these medications for too long, because it can cause some complications, such as some bad constipation. More extreme cases, they become habit forming, or you can get addicted to them, which you want to avoid. So use them as you need it. Don't be afraid of that, but just only take what you need. Okay. Now, very common in these laparoscopic procedures is that you may develop some right shoulder pain, and that's occurs because of the gas that we use, the carbon dioxide. When it dissolves down, it turns into a type of an acid, not a dangerous acid, but a type of acid for your body, and it gets absorbed by the nerves, causing pain in the shoulder. Now that, a lot of times pain medication won't take care of that. But what you can do is walk around as much as possible the next day. Drink a lot of water because your body just has to metabolize that stuff, and it usually does go away, but it can be quite annoying. Let's see. Also, now after you get your gallbladder removed, you have no dietary restrictions, but you should introduce fats into your diet very slowly. After your surgery, I don't want you to go out and eat a huge steak covered in butter or a huge pizza with pepperoni, whatever. Introduce fats slowly. So maybe tonight or tomorrow morning, you can have a little bit of fat in your diet, see how it goes. You may experience some bloating, you may experience some really loose stool. That will go away as your body adjusts, and it does take a couple days for that to happen. So introduce fat slowly back into your diet, but usually after maybe 3 or 4 days, definitely by the end of the week, you should be on a full, regular, unrestricted diet. If you do experience a lot of loose stools or bloating, try eating a lot of bananas. That helps a lot, as well as dry toast, no butter, dry toast. Okay, and then it's very important that you walk around as much as possible. Don't lay in bed. The next day after the surgery, or tomorrow after your surgery, you should be up and about, walking around. No heavy lifting, greater than 15 pounds at least until you see us in the office, just to make sure your stitches don't open, but otherwise be active as possible, but no strenuous exercise, at least until you see us in the office. Other than that, I think that pretty much covers your postoperative, your early postoperative course, and we'll talk more when you see us in the office. If you have any questions for us, you could either email us at our email address that we provided to you, or give our office a call. And as always, if you have any questions at all, you should reach out, because we want to take care of things earlier than later. And that being said, good luck, take care, and we'll see you soon. All right, take it easy, bye.